I do want women to know that there is an alternative to suppressing their bodies with hormones, that they can see their body as a good and they can live in that body holistically.
Totally. Oh my gosh.
It's amazing.
Join co-hosts Jamie Rocci and Teresa Kenny as they educate women about the beauty of the feminine design and empower women to take charge of their health.
They're going to be so amazing. You're going to be so empowered by understanding your feminine genius and your hormone genius. I don't think I could live my whole life knowing this and not sharing it with anyone. Everyone, welcome to the Hormone Genius Podcast. Today I get to interview Teresa. We get to do a Q&A. I feel like we haven't done one of these in a while.
Yeah.
I'm pumped. And the topic will perk your interest. Because I'm going to be doing a Q&A about our very awesome girl part, lady part, the VAG.
VAG.
The VAG. It's an acronym. I'm really excited. So as you ladies realize and know, there are many things that our vaginal discharges can tell us about the state of our health, whether that mean that it points us in the direction of understanding and knowing that we're healthy in regards to our hormone levels as the signs of health. And then also maybe when something's a little wonky. Mm-hmm. And we're going to just really dig into this. And I always make the joke, Teresa, that it's so interesting because in high school, I was so uncomfortable about all the things about being a girl. Mm-hmm. And that middle of the month, like our cycle, that vaginal discharge, I was so embarrassed by it because I didn't know it was normal. Mm-hmm. B, I didn't know it was a sign of health. C, no one talked about it. And dare I not bring it up to anyone. And so it's just funny that I was so grossed out by it all. And now it's like my job to talk about vaginal secretions. And I love it. It's kind of funny the way that works out.
Yeah.
So let's start.
Awesome.
Okay. So Teresa, tell us a little bit about vaginal discharge, and maybe we can even begin with what is healthy and what we should be looking for. And then we'll kind of flip the coin and talk about the other stuff.
Sure. So that's good. It's always good to start with what's normal. And again, since we have empowered women on this podcast about the healthy signs of their feminine design and fertility, mucus is literally like the primary thing we talk about, because it's the one thing that tells a woman what's going on hormonally in this main event of ovulation. So normal is this beautiful cervical mucus, right? It looks like in some ways egg whites. It's got a clearness to it and it has a stretchiness to it. And it's a very watery mucus at times. And it's a very slippery mucus. And this mucus that's apparent during fertility or ovulation, it happens for about anywhere 3 to 5, 6, 7 days. And it's individual to the woman and how that presents. But there definitely is always a buildup and then a stopping of that mucus after that ovulation event is over. And then there's just vaginal discharge, right? This is just all the other junk. And some women have everyday junk and some women don't. Mm-hmm. And there is a normal to that as well. So the vagina is its own microbiome. Your gut has a microbiome. We talk about the gut microbiome quite a bit, but your vaginal health has its own microbiome. And because of that, it has a life of its own, you could say, and it's meant to keep the vagina healthy and to ward off offenders, basically, or pathogens, we could say. In doing that, it basically has a way to renew itself always. And so we call this vaginal sloughing. So the lining of our vaginal walls, just like everything, our skin on our arms, our face, everything has to slough off and renew itself. And the vagina is no different. So it creates a discharge. And usually that discharge is somewhat like hand lotion or pasty and kind of cloudy and kind of clumpy at times. Mm-hmm. You might see it in your underwear. Still very normal, doesn't cause any irritation, doesn't cause any issues. And it is, it doesn't cause any pain. It doesn't have any odor to it. It's just normal, healthy discharge. Mm-hmm. So that's kind of the normal there, you could say.
Okay. So I want all the listeners to know that having discharge mid-cycle is healthy. When we notice that dischargement cycle, it means that our ovaries are producing estrogen and that we are becoming fertile, that we are fertile. So if one were to have intercourse, sperm can survive in this cervical fluid, the cervical mucus, and this discharge is normal, and we're never really told much about it at all. And it's actually an essential ingredient to become pregnant. So you need good eggs, good sperm, good mucus. And this good mucus part is essential for achieving pregnancy. And it's often the ingredient that is never even brought up. So if you are having a hard time getting pregnant, and again, this episode is going to be more about like vaginal infections and things you need to know, but we want to talk about state of health first, what normal is. But if you are listening to this and you're having a hard time getting pregnant, and you have not brought up anything about vaginal discharge, you and your doctor haven't talked about this yet, please bring that up or email us and ask for some suggestions, because there's always things in our toolkit. And that also may mean it gives us information and data about the state of your hormones and lab work that could be done to investigate more. So that's a little side note there. All right. So Teresa, we know kind of, again, a quick overview of what is normal. What would be an abnormal discharge a woman would want to be seen for?
Most women are intuitive and know when something is abnormal, but most of the time that's because it causes some sort of discomfort in our body. So it's either unpleasant because it feels unpleasant, or maybe it smells unpleasant. It might be not a normal color. So typical things that in terms of how the discharge looks that's not normal, is it more watery, meaning that when I go to the bathroom and wipe and I look at the tissue, it's kind of all the time, like I see there's almost like a glariness or a water on the tissue. That may be a sign of an actual imbalance or an infection, especially if it goes along with feeling not comfortable again. Or if the discharge has a strong either yellow or even a green tinge, particularly green is abnormal. And so that definitely needs to be looked at. So again, if the color is off, Jamie, so if there's a green tinge and or a yellow tinge, and the mucus, again, with yellow, it tends to have a very strong yellowness to it. Whereas sometimes there is a yellow in mucus discharge, and that's normal because it's around our ovulation event. And we have this breakdown of red blood cells, and there can be a slight tinge of yellow that's normal. But the key point is that every woman knows what her kind of pattern of discharge is. For some women, they only make discharge at the time of their fertility. For some women, they make a discharge kind of chronically all the time, but it's normal for them. And they don't have any symptoms that are going with that. Mm-hmm. So what's normal for the woman needs to be understood as it's a pattern that is the same for her every cycle or every day. And if that changes and she's seeing something totally different, and it's not a normal color for her, it's not a normal sensation for her, she's irritated, there's an odor, anything like that needs to be investigated. And vaginal infections are very common. In fact, most people probably think of yeast infections as the most common infection for women, but the most common infection is a bacterial infection, sometimes associated or called BV or bacterial vaginosis. That's actually, when we go and we look at cultures, that's 40 to 50% of all infections end up being bacterial vaginosis, whereas yeast infections end up being about 20 to 25% of infections. And then there's some, a variety of other infections that can be found as well, seen at the doctor's office. A lot of times we think of sexually transmitted diseases, but that's not really what we're focusing on here. We're focusing on more just like imbalanced bacterias or bacterias like fungus that are out of control, or a bacteria that isn't supposed to be present. And there's basically, just like in your gut health, there's a dysbiosis or an imbalance of the bacteria in the vagina.
So I have two questions, and you can answer them in whatever order. Number one, is there harm if a vaginal infection is not treated? And then number two, with the bacterial vaginosis, and even with the yeast infection, I guess the answer is yeast, but what causes bacterial vaginosis?
Mm-hmm. Okay, so is there harm? Well, in actuality, we're learning more about this, and there's more study that needs to be done. But from a reproductive health standpoint, it is possible that these bacteria, particularly the ones that are bacterial vaginosis, can cause problems with pregnancy and even fertility. And they can also, of course, cause basically a discomfort and a inflammation in the body that really shouldn't be there long term. But of course, no one wants to have anything happen in a pregnancy. And what we know by research is that bacterial vaginosis actually does increase the risk of premature labor. So it's really important for women who have, any signs of infection to really get that tested in pregnancy. And I often find that many doctors aren't really interested in this, or maybe don't understand the research and how important it is to know about these bacteria. But if we can treat a woman's bacterial vaginosis or imbalance of that bacteria, we may help prevent them from having an early delivery. And there's just so much more research that needs to go into this, Jamie. And I know in the work that I have done over the years, I've really been interested in what causes premature labor. I had a premature labor. It was actually my first pregnancy. And this really does go along the lines of understanding discharge, because if you looked at my charting when I was pregnant with my first daughter, I had a chronic discharge. It was very, very yellow. It was very, very copious, just means like I had quite a bit of it. And it was all of the time. And I didn't know that was abnormal. But when I started charting, it was apparent that I was seeing this discharge. I was pregnant. And when I got to about 17, 18 weeks of my pregnancy, I started experiencing quite a bit of cramping. And even when I would exercise, I would get a lot of menstrual cramps afterwards. And again, I was seeing this discharge. Didn't even bring it up to my doctor because, again, it's not something you talk about really. I didn't even know it was abnormal. And I ended up in the hospital at 28 weeks, dilated to 3 centimeters and in labor. I look back on that pregnancy and I know intuitively, and just now understanding so much more about women's health and about all of this stuff that we talk about, Jamie, that I think there was a chronic infection going on at that time, and it was putting me into an early labor. Praise God, I was able to go on bed rest, and I was able to carry my baby until almost 36 weeks, basically. But that told me something about my body at that time. In my next pregnancy, I was on top of it right away. And I ended up getting treated with a lot of antibiotics. And that baby, I went all the way to 40 weeks and even had what we call a cervical cerclage, which is a stitch that they put in the cervix to make sure that my baby wouldn't come early. So it just, my intuition is that there was something wrong with that discharge. And I never had it again. Once I was treated with the antibiotics in that second pregnancy, it all went away. And so I think that, and now research is showing us that there is a possibility that these bacteria actually can do further harm. And so it is something I think we as women really need to be intuitive about and to watch and to see our doctors for.
Yeah. Oh my gosh, Teresa, I did not realize that. I'm sure that freaked you out. First time being pregnant and you're dilated at 3 centimeters, week 28. Scary.
Yeah, it was very scary. And I'll never forget that day in the hospital because a resident came in, and frankly, sometimes residents think they know everything and don't know anything. And she came in and she checked me like a physical check of my cervix and said, "You're having your baby today." She's like, "There's no chance we're going to, keep this baby in." And I was upset, not only because she had no hope for me, but I was upset because she actually put me into labor with that check. And I had to advocate for myself. And I told my doctor, I said, I don't want anybody else in here checking me because that threw me into labor and I ended up on magnesium sulfate. And so, yeah, that's just another example of women, needing to speak for themselves sometimes and knowing what's best for their body, is important.
Gosh. Oh my God. Okay. So we just talked about, the harm of leaving it untreated, but what causes these infections?
So it's really interesting in the vaginal area. There are, I think women have heard of this, lactobacillus. You've probably heard of lactobacillus, Jamie. And we often hear about that as being kind of the primary, bacteria that kind of helps the health of the vaginal area. And there's actually 4 lactobacillus that are in the vagina. Lactobacillus gasseri, Lactobacillus jensi, Lactobacillus crispatus, and Lactobacillus inners. Now, the first 3 that I mentioned, their job, Lactobacillus' job, is to create lactic acid and to also help the production of hydrogen peroxide, which both of those things, what do? They keep the vaginal area acidic.
Mm-hmm.
And so, not in a dramatic way, but in a way that balances, again, negative pathogens from getting in and keeping healthy pathogens there, basically, or not pathogens, but healthy bacteria there. So, and we actually know that that fourth one, Lactobacillus inners, if you get an overgrowth of Lactobacillus inners, that you'll actually be more likely to get bacterial vaginosis, because that particular lactobacillus doesn't do a good job of making lactic acid, and it actually can put your vaginal microbiome at risk for a bacteria being developed. So this is the coolest part of doing some of this stuff is you can test this stuff now.
Yeah.
In the cultures. Now, some doctors, I say they use the very basic test. It just tests for candida. It just tests for bacteria. It's like only 2 things on that test. But there are really beautiful now testing that can actually tell you what the vaginal microbiome is doing, as well as picking up bacteria that shouldn't be there, so that you know exactly what's going on and how to target it. So I may find a woman that's symptomatic. Maybe I don't find an actual bacteria, but she's got a whole host of this Lactobacillus inners. And I know that she's probably transitioning to a bacterial vaginosis.
Interesting.
So, and again, that particular thing, and I just want you to know this as women, any bacteria that's in that category of bacterial vaginosis, and there's several of them, there's Gardnerella, there's Atopobium, there's Prevotella, there's a Megaspores. These are all what we call anaerobic bacteria. They tend to cause like a dampness. So women will walk around and they kind of just feel wet.
Yeah.
And it may not be like, again, that itchy or that off. It's just like kind of feel wet all the time.
Yeah.
And again, when I go to the bathroom, I might see this glariness or wateriness. And that I always ask those questions, because then I know I'm supposed to be testing for that.
Yeah, totally. Okay. So if a woman is listening to this, because again, for women who don't maybe chart their cycle and they're hearing this, even though we just said that it's healthy to have discharge mid-cycle, it's a sign of health. What would you say? I know you keep saying glary and wet, but because we know that those words might mean different in our minds in terms of how it's translated, can you describe, like, again, the main difference in terms of what is healthy and then what is something that might mean infection?
Sure. So again, if it's ovulation mucus, it's generally going to have like an ability to pick it up and stretch it beautifully, right? But when I say like a glary wetness, that doesn't have any mucus with it. It's just the wateriness in and of itself. Yeah. So that's kind of the main difference there. There's not the mucus, the beautiful mucus that's with it. Mm-hmm. And then I would just stress again that most of the time when you have an abnormal discharge, there's generally some symptom there that's making the woman feel like just something's not right.
Sure.
This is super interesting. And we've actually done studies with this with the Creighton model system that, and Jamie, since you teach the Creighton model, you're probably aware of this, but when we see a frequent description of the 2W, and in Creighton model, that just means I see wateriness on the tissue. Mm-hmm. If we see lots of 2Ws, what Dr. Hildreth at St. Paul VI Institute did is he tested those, and those tended to have more infection, more bacteria is present. So even in charting, we're doing research to show that there's some kind of element that you can actually see in the charting to help us diagnose vaginal infection. Mm-hmm. I think I'm very interested in this stuff, Jamie, because not only I mentioned my premature birth story and how I relate it to my identification of that mucus and that being abnormal for me. But I've also struggled with chronic yeast infections and chronic bacterial infections. And you probably haven't, Jamie, but the woman who's listening right now, who's been in the doctor's office many times and frustrated by the fact that they keep getting the same infection back, I empathize with you, because not only do I treat those patients, but I am one of those patients. Yeah. So, let's talk about, like, if you are in the category, what can we do? What can you do if you've already been treated for a yeast infection 3 times this year? How do we prevent that?
I want to share one quick thing. I had a friend reach out to me, somebody I know, and I hope I'm actually going to send this to you, friend, this episode, because I think it's really going to help. But she was so frustrated because the doctor she was seeing literally just said, like, I can't help you. Like, there's nothing I can do that will help you, like, as though they were annoyed. So they dismissed her as a patient, and she reached out and she just was so frustrated, but she was seeking help. And so what we're going to talk about next, Teresa, I know you just said, okay, so for those of you who are suffering with this, what do we do next? So I'm excited for this part because, again, as somebody who doesn't experience that a ton, and nor necessarily would I say it's often that I come across women who has really struggled with this chronically, I'm interested to hear the suggestions you make.
Yeah. So let's just first talk about lifestyle things, because we know that there's a lifestyle mechanism to everything. And so nutrition wise, women who tend to eat a lot of refined sugars, especially if you're already getting infections, that may be feeding bacteria, right? What does bacteria eat? It eats the same stuff you do. Yeah. It just happens to also like and crave the same stuff you do, which is a bunch of crap and sugar. Yeah. So sometimes removing that out of the diet actually can make a big difference, which, that's a hard one for people to manage, but I have seen it work when people really make a concerted effort to do that. So we know about, like vaginal health in terms of cleansing. And Jamie, you could probably speak to this too. But we want to avoid number one, you want to avoid antibacterial soaps. I mean, I'll never forget. This is, again, kind of the 90s, probably late 90s, when triclosan, it was an antibacterial agent. It was added to every, soap to kind of prevent infection. And, Dial and all the Irish Spring, they were all adding this particular and so that's why you saw all these soaps say antibacterial, right? That sounds really good.
Right.
Except it's not really good when you do that in your vagina. It might be okay for your hands. And I don't even know if that really is the truth. It's probably not good for us in general, but you need those healthy lactobacillus, and those antibacterial soaps will kill those faster than you can imagine.
Yeah. Jeez Louise. Okay. So ladies they probably don't put that in the soaps anymore. Like for body soap, do they?
Yeah, you can still, I'm sure, find it, but anything that says antibacterial, let's just put it that way, you shouldn't be using. Right. And then we all know too, Jamie, about what types of scented things and chemicals. Absolutely. We just did our podcast on endocrine system disruptors. You shouldn't be using any of that anywhere, but especially down there in your PAG. And
often when I'm meeting with people, I'm like, do you use fabric softeners in your dryer when you're doing your laundry with your undies, and that's always how I ask in that kind of way. And they're, yeah, no worries. Like, that's what I do. I love fabric softener. I'm like, get rid of the fabric softener, especially. So like, if you think about this, and maybe we talked about this in the last episode, but if you're putting a fabric softener sheet in the dryer and that fragrance, and then whatever chemicals are on that sheet, they're getting hot and the molecules are moving quickly off of it onto the underwear. And we did talk about this in our last episode with endocrine disruptors, but we were talking about like your clothes in general, how you're wearing your clothes and your skin's absorbing it. But think about wearing your underwear and then those fragrancy toxic chemicals, like legit right by your VAG. That is not good. So anyway, ditch the fabric softeners big time. And then with douching, like after intercourse, you do not, like, your vagina is a self-cleansing organ. So you don't need to like scrub a dub up there. You don't need to do that.
No, absolutely. And the other thing we want to talk about, Jamie, is just that, wet clothing, anything that breeds kind of wetness in the vaginal area, we should avoid. So your stretchy pants, your Athletica, your Lululemons, your swimsuits, all of that workout clothing, once you're done working out, get that stuff off right away. And I often think about this, and I don't know, sometimes I'm almost embarrassed to say it, but maybe think about just getting all new underwear. Like if you've been struggling with infections, it might be good to just ditch the old and get a fresh start, just because bacterias and fungus and stuff, they are good at surviving, so it's sometimes good, I think, just to kind of renew and especially in that area. So that's a good thing. Now, other things we can do. This is probably one of my favorite kind of home remedies. Anybody can do it. And especially those who suffer from chronic vaginal infections. It's boric acid suppositories. So boric acid, and some of you might use borax or borax in your laundry soap because it's a very natural cleanser, kind of similar to baking soda. But boric acid has been used for a very long time to treat vaginal infections, especially more alternative practitioners. Midwives might use it to treat yeast infection or even a bacterial infection. But I love it for prevention. And so what's most often a trigger for a vaginal infection, and urinary tract infections for that matter? Intercourse. very often when women come back in and they've got the same thing going on, it's like, it's always after they have intercourse. It stirs everything up, right? It's just, we know that that's likely. Mm-hmm. So if you insert one boric acid capsule, these are over the counter. They generally come as 600 milligrams. There's a variety of brands you can get out there. After intercourse, one of those in the vaginal canal, just inserted, and sleep with that, it will flush out all those bacteria. So it has, for me, been a lifesaver for prevention of vaginal infections. And it's been a lifesaver for a lot of my patients as well. So that's a really good kind of alternative remedy. And I would say, so when we think about acid, and again, how important the acidic environment is to the urinary system and the vaginal system, we have to remember that. So we have to keep hydrated, super hydrated. And then we also can use things to our benefit to keep things acidic. So many people have heard of cranberry, right, Jamie?
Yeah, totally. Cranberry tract. Yeah.
You think you're getting a urinary tract infection, you're drinking a bunch of cranberry juice, right? Yep. That's kind of the oldest trick in the book. Well, why does that work? And it can work is because it helps that urine become acidic again. And so it will kill off some of those offending pathogens just by acidifying the urine. And so you can actually use as a prevention something called D-mannose. And D-mannose has been studied quite a bit. And it also is an acidifier, and it's what's in cranberries. So you can find D-mannose over the counter. You could take 2 of those after intercourse. You can take it on a daily basis, actually, just as a prevention in general. So I think that's a great kind of, natural thing that anybody could do at home.
I took D-mannose right after my husband and I got married. I was getting urinary tract infections all the time. And so I was on antibiotics. I did the monostat, whatever's, and it was just crazy. And so, yes, I started preemptively just taking D-mannose all the time. And it was the only thing that ever really worked. And so I can testify to the effectiveness of that for sure.
That's great.
Okay. So let's say, and this, we're going to be wrapping up, which is, I love this episode. I didn't think I'd love this one as much about the VAG, very awesome girl part. I don't know. But I actually really like this because I'm sure so many women just don't feel like they want to bring this up to anyone. But what if somebody's still struggling and they're doing the boric acid and they're doing everything and there's still a struggle? Mm-hmm. Like what's their next step? Is there a next step?
Well, let's again reiterate how important it is to see a medical practitioner, a medical doctor. If you are actually symptomatic, you're doing things at home and it's not working, you got to see your doctor and you got to get the right treatment for the right bacteria, the right bug. So there are times when medicine is absolutely necessary. So I don't want to play that down, that this isn't an all natural thing. Now, I would say if you do have to go on antibiotics, what do we know about antibiotics? I mean, they work really well. But at the same time, they have these negative side effects, and one being that they alter the gut biome and even the vaginal biome. So we want to put back those good, healthy bacteria. Now, there's still so much research that needs to be done on this because people will ask me, well, if I just take a probiotic, is that going to help my not getting vaginal infections? Well, that's questionable. We don't even know sometimes if probiotics actually stay in the gut and they're not just killed off once they get there. So, what I say to people is if they're working for you, great, you should take them. And really anybody on an antibiotic should get a high quality probiotic and take it for at least the duration of your antibiotic and 2 to 4 weeks after that to restore that. But there are a couple of companies that have made more vaginal probiotics, and it makes more sense to me because, again, how does it get to the VAG going from your mouth to your gut, through your intestines, it doesn't even make sense,
Right. So
to put it right there does make sense. And so we've got Gero makes one called Femdophilus that can be used vaginally. There's one called ProFem too. So that makes more sense to me. And I hope there's more companies that are going to come out with more targeted probiotics for vaginal health because, probiotics are great. And if you, again, find a good quality one, I think that's important for all of our guts. But whether or not they can get where they get to is another question.
Oh, amen. And if any of you guys have questions in terms of probiotics that I recommend, definitely reach out. And Teresa, of course, both of us. Okay. So Teresa, we're wrapping up this episode. Actually, can you believe it? But I want to be sure to say this before we forget. We are going to be launching a mini course and we're really excited about it. If you go to our website, hormonegenius.com, you will find like a pop-up thing that says be on the wait list if you want to learn more about courses that we're offering. So our hope is to be able to launch that maybe before the end of the year. We're shooting this in 2021, just as an FYI if you're listening to this later. So if you want to learn more, please go to our website to learn more. But Teresa, you never cease to amaze me. I learned so much from you. And again, I'm not surprised that my mind has been blown about our very awesome girl part, the vag, the VAG. Today.
Yes. I'm so excited. We'll probably have to do another episode, Jamie, because I still am swimming with thoughts and ideas about this particular topic. And I know that it affects a lot of women. So we'll swing back around someday to the VAG. But for now, signing off on this one.
All right. Thanks, Teresa.
Thanks for listening to the Hormone Genius podcast. Please remember to share our podcast with your friends and family, and also follow us on social media. If you were not aware, we have a YouTube channel. So if you could like and subscribe to our YouTube channel to stay in the loop with all of our latest episodes, we would appreciate that. Thank you so much for your support. We are excited to journey alongside you as you discover the beauty and the genius of your hormones.